The centerpiece of the cardiovascular system is the heart, and the major blood vessels that circulate oxygen and nutrients throughout the body. The external anatomy of the heart is comprised of the great vessels, including the superior vena cava, the inferior vena cava, the aorta, the pulmonary arteries, and the pulmonary veins. There are 4 chambers of the normal heart, consisting of the right atrium, the right ventricle, the left atrium, and the left ventricle. The major epicardial arteries that supply blood to the heart are the right coronary artery and the left main coronary artery, which typically branches into the left circumflex artery and the left anterior descending artery. The internal anatomy of the heart includes the myocardium, or heart muscle, and the electrical conduction system of the heart. Within the right atrium lies the sinus node, or sinoatrial node, which is the pacemaker of the heart. The atrioventricular node, or AV node, lies near the interatrial septum and conducts electrical impulses from the atria to the ventricles. The 4 main chambers of the heart are separated by a system of valves which ensure the circulation of blood in the proper direction. The tricuspid valve separates the right atrium from the right ventricle. The pulmonic valve separates the right ventricle from the pulmonary arteries. The left atrium is separated from the left ventricle by the mitral valve. The interventricular septum is a thick wall of myocardium that separates the left and right ventricles. And finally, the aortic valve separates the left ventricle from the aorta. Normal blood flow through the heart is a continuous circuit. Oxygen-poor blood returns to the heart from the upper body through the superior vena cava and from the lower body through the inferior vena cava into the right atrium. During diastole, or the relaxation phase of the cardiac cycle, blood passes through the tricuspid valve into the right ventricle. Then during systole, or the active contraction phase of the cardiac cycle, the tricuspid valve closes and the pulmonic valve opens, ejecting blood into the pulmonary arteries. Blood then travels to the lungs where it receives oxygen and returns to the heart via the pulmonary veins to the left atrium. Again, during diastole, blood passes through the mitral valve into the left ventricle. During systole, the mitral valve closes and the aortic valve opens. Blood is expelled into the aorta and oxygen-rich blood is supplied to the body. In addition, oxygenated blood is supplied to the cardiac myocardium via the coronary arteries, which arise from the ascending aorta. By this pathway, a continuous circuit is made in which oxygen-poor blood returns to the right side of the heart, is pumped to the lungs to receive oxygen, returns as oxygen-rich blood to the left side of the heart, and is finally pumped into the aorta and delivered to the body. The electrical conduction system of the heart allows the cardiac myocardium to coordinate a rhythmic and synchronized cardiac cycle. Electrical impulses originate in the sinus node. The sinus node is therefore referred to as the pacemaker of the heart. The atrioventricular node gathers the electrical impulse from the sinus node and conducts the impulse to the ventricles through the bundle of His, bundle branches, and Purkinje fiber system. By this mechanism, the atrial and ventricular contractions are synchronized. By placing electrodes on the surface of the body, the electrical activity of the heart can be detected and recorded by an electrocardiogram, or ECG. Each part of the electrical pathway is represented on the ECG. Therefore, the activation or depolarization of the atria corresponds to the P wave on ECG. The activation of the ventricles and subsequent contraction corresponds to the QRS complex, with the Q wave being the initial downward deflection, the R wave being the upward deflection, and the S wave being the subsequent downward deflection. The repolarization or recovery of the ventricles can also be seen on ECG and corresponds to the T wave. The duration of each part of the cardiac cycle can then be measured on ECG by the corresponding interval. For example, the time it takes to complete ventricular activation and repolarization can be measured from the beginning of the QRS complex to the end of the T wave, called the QT interval. Cardiac arteriograms, or coronary angiograms, are obtained in the cardiac catheterization laboratory by passing a catheter into the ascending aorta and injecting contrast dye into the ostia, or opening of the coronary arteries. Images are then obtained using fluoroscopic X-ray. In the majority of people, the right coronary artery arises from the right side of the ascending aorta and supplies blood to the right ventricle and inferior wall of the left ventricle. The left main coronary artery arises from the left side of the ascending aorta. The left main typically bifurcates into the left anterior descending artery, which supplies the anterior wall of the left ventricle, and the left circumflex artery, which supplies the lateral wall of the left ventricle. By this method, coronary angiography can differentiate normal blood flow through a coronary artery from abnormal blood flow, as seen by a narrowing of the artery. This narrowing occurs most commonly from plaque buildup over time, or atherosclerosis. A significant narrowing of a coronary artery can lead to chest pain or a heart attack. Remember that the QT interval represents the time it takes from the onset of ventricular depolarization to the end of ventricular repolarization. This corresponds on an electrocardiogram as the start of the QRS complex to the end of the T wave. Because this period can vary depending on heart rate, the interval is commonly corrected for heart rate and referred to as the corrected QT interval, or QTC. A normal QTC interval is less than 440 milliseconds, but in females can be slightly higher. Prolongation of the QTC interval can occur with genetic abnormalities, certain medications, and metabolic derangements. The significance of a prolonged QTC interval is that it can lead to a life-threatening cardiac arrhythmia called ventricular tachycardia, or more specifically, torsade de poids. Ventricular tachycardia occurs when the ventricles are contracting rapidly and independently of the normal conduction system. Ventricular tachycardia can degenerate to an even less organized and more rapid rhythm, ventricular fibrillation. In ventricular fibrillation, the ventricles are completely disorganized and inefficient, causing cessation of normal blood flow. Without medical intervention, ventricular fibrillation leads to asystole and sudden cardiac death.